Okay, Anna, could you, moving on to just sort of the general public, you've told us a bit about what you are doing in Rise Up PPD. Could you tell us what you think are the five most important facts that women and just the general public should know about peripartum depression?
Sure. So, yeah, there are many, of course, many others, but I just select five that I think are particularly important for everyone to be aware of. So, first, perinatal depression is a common condition. It's not uncommon at all. It affects a significant number of men and women across the world. It affects between 10 to 20% of all new mothers, and it affects between 4 and 10% of all new fathers or fathers to be. So it's not so uncommon as we could think. And it's not a sign of weakness or a personal failure, but it's rather a condition that we have to address and to look after and offer the best support that we have. The second thing that I think it's really, really important is that perinatal depression can affect any person. So it does not discriminate age, it does not discriminate the social economical background, it does not discriminate according to your educational level. So it can happen to any of us. So regardless our circumstances, and it's critical to recognize that anyone can eventually experience these symptoms and to encourage this person to look for help. The third thing that I would pinpoint is that perinatal depression is very heterogeneous. So different persons can present different or distinctive symptoms. For some, it can be a lowering of their global energy. For others, a lack of sleep. For others, a decreased appetite. For others, an increased irritability or anxiety or the feeling of hopelessness. However, one important thing is that this is not the same as the symptoms that we can, or the feelings that we can experience when we are only overwhelmed by this perinatal period and all the tasks it has around. It's a different thing. Its intensity. Intensity is different, and it can actually compromise our functioning every day. The fourth thing, it's seeking help. So we should seek help. It's important to emphasize that if people experiencing symptoms of perinatal depression, even if they are not sure if this is perinatal depression, they should talk about it. They should look or address these worries with their healthcare professionals or mental health providers. They can eventually look after support groups. They could eventually talk to a friend. But the first person that has to stop minimizing the symptoms is ourselves, right? So we can start the dialogue about what can I do to address these symptoms. And a comprehensive support is critical. So besides seeking help and recovering from PPD, requires a very different, very different support systems. So we need to build strong support systems. And these support systems should consist of our healthcare providers, our neighbors, our friends, our family. And it is important to prepare this support system from the start, from the beginning, right? Because it can be also preventive. It's not only about taking care of those that already feel symptoms or are experiencing symptoms, but also help them prevent to feel so overwhelmed or hopelessness that they cannot, at some point, they cannot function anymore. And the final message that I have is that not seeking help and not completing treatment or accepting treatment is generally worse than any treatment that is nowadays available. So the impact on our own functioning and on our baby, if you are pregnant or in the postpartum period, the impact that our experience, emotional experience, has in our children is enormous and is far worse than any secondary effect that the available and evidence-based treatments could offer or could have aligned. So it is important to understand that psychological symptoms have a real biological impact in the baby that is inside the mother that is pregnant, and the stress hormones that the mother's body segregates while breastfeeding, they can also um, be transferred to the baby through the breastfeeding. But most importantly, the unavailability to be with the baby will have a very critical impact on the baby's neurodevelopment. So addressing and treating perinatal depressive symptoms is the best thing that we can do for ourselves and for the next generation.